Hi, good morning, everyone. Today, let's discuss about sociology. So, sociology. First of all, what is sociology? How the words are derived? Sociology is derived into two words, that is societas and logos. Societas means society, logos means study. The study of society is called as sociology. It is the study of systemic social activities, societies, and groups which are there in society is sociology. There are two types of sociologies, that is micro sociology and macro sociology. Micro sociology, as the name itself indicates, micro means it deals with only small units of people and small groups of people within a large society. And macro sociology, in the name itself, macro means what? Large. So this macro sociology deals with analysis and study of large societies. So this is sociology. Next, socio-cultural factors. How the socio-cultural factors will reflect the health of your society. You see, the first socio-cultural factor is education. So education, if a person is having proper education, then he will be having better decisions on health and a good lifestyle. He can maintain good lifestyle. And second factor is income. If a person, if an human being is having good income source, then he will be having good medical supervision and he can maintain his health. And the next one is access to healthcare. How you can get access to good healthcare? By having good education and by having good income, then a person will be having a good access towards healthcare. And the next factor is family. So family is also responsible for health of a person. Genes is the most responsible thing which will be having good health or bad health of a person. So the genes controls the health of a person. If you get a perfect genes from your forefathers, then if the genes are healthy, then the person will be healthy. If the genes are having some disorders, then the person will be having some disorders. So that is why family is also one of the socio-cultural factor towards the health of a people. Next, culture. Culture is very important. The lifestyle a person maintains, the friend circle a person maintains, and habits a person is having will decide the health of a person. If a person is having good lifestyle, good friend circle, and good habits, then he will be having healthy state. So that's why the culture is also one of the responsible socio-cultural factor towards maintaining the health of a people. And environment, the climatic conditions plays most important and most crucial role for maintaining the health of people. Next, urbanization. See, urbanization. What is urbanization? The movement of people towards cities. The movement of people towards cities is called as urbanization. See, there are two types of areas. You can see the three types of areas: village area, rural area, urban area. Village area means villages. Okay, rural means somewhat developed, and urban means like cities where the development is more and more. So the movement of people towards cities, the movement of people towards cities is called as urbanization. So what are the health impacts which we will get with urbanization? The health impacts which we will get with urbanization is mainly infectious diseases. See, infectious diseases because of the pollution of air and water. Because of air pollution and water pollution is more in urban areas, the people will get more and more infectious diseases. And also in urban areas, the people are more addicted towards tobacco, alcohol. And also because of their job factors, they will be having lack of exercise, lack of physical exercise. Because of those reasons, the people will get non-communicable diseases. And also in urban areas, substance abuse is also more. Substance abuse means what? Abusing a substance, using the drugs for unhealthy condition, means using drugs. Because of the drugs, your health will become ill. So using those drugs is called as substance abuse. Using the drugs like cocaine, etc., that is called as substance abuse. It is also more in urban areas. And road traffic accidents, because of lot of public is present in urban areas, road traffic accidents will also be more. It also reflects health. And housing and sanitation conditions. There are no proper housing and good sanitation conditions in urban areas. Because of that, more diseases will come to the people whoever live in those areas. And water, food, and nutrient crisis will be there in the urban areas, and climatic changes will also be more in urban areas. And social environment like slum areas are more in urban areas in cities. Because of that, no proper maintenance of sanitation will cause some diseases. So these are the health impacts with urbanization. Next, poverty. What is poverty? The lack of basic necessities of human is called as poverty. Lack of basic necessities means lack of food, lack of shelter. This comes under lack of basic necessities. This is called as poverty. There are two types of poverties: absolute poverty and relative poverty. Absolute poverty means if the family income is inadequate to buy basic things in life. The family income is very less, so that you can't buy your basic things in life. That is called as absolute poverty. And what is relative poverty? If there is an economical imbalances on location or society. For example, you can afford your amount, your salary only in rural area, but if you have moved to an urban area, then your salary is not sufficient. Then that is called as economic imbalance because of location or society. So that is called as relative poverty. So this is the difference between absolute poverty and relative poverty. Then what are the effects of poverty? The effects of poverty, the poverty may be affected on different sectors like on society, on health, and on economy. On society, how the poverty will affect? The poverty will affect on society by homelessness. No homes will be there because of this poverty to the people, and child labor is more in society, and stress conditions are more in the public. On health, the poverty will cause malnutrition, mainly under malnutrition is caused because of this poverty. On economy, the poverty will also affect the economy of the society, how there are no sufficient jobs, no facilities for the people, and because low economy, this will affect. The poverty will affect on these sectors. These sectors will be affected because of the poverty. Next, steps to decrease the poverty. How to decrease the poverty? See, these are the steps which we can decrease the poverty by increasing the employment opportunities. If you increase the employment opportunities, people will be employed more and more, then the poverty will be decreased. Then encouraging the self-employment plans. If the government encourages the self-employment plans by providing them some credits, then the poverty will be reduced. And fulfilling the primary needs like food and water. Food and water should be fulfilled by the government. Then improving the subsidy rates on public distribution systems, public distribution or public transportation systems. If you provide some subsidy rates, that will decrease the poverty. And providing some health centers for free treatment to the public, and providing free education facilities, to the public, and promoting the awareness regarding the birth control. The birth control is very, very important. Birth control is very, very important. If you promote awareness regarding the birth control, so automatically if the birth is controlled, then the population will be reduced, so then poverty will be reduced. Next, hygiene and health. What is hygiene? Hygiene, in Latin, hygia means nothing but it is goodness of health. Hygia means goodness of health. There are two types of health, that is physical health and mental health. How you can maintain your physical health? By maintaining fitness, by doing regular exercises, and by eating the balanced diet, by taking a good rest, you can maintain your physical health. Then how you can maintain your mental health? If you feel safety and secure, then your mental health will be good. And if you can adapt to the difficulties provided by the life, then your mental health will be good. And if you stay positive in any type of condition, then your mental health will be good. And if you are having habit of helping others, connecting others, communicating with others, then your mental health will be good in condition. So these are the two types of healthy conditions, physical and mental, and how to maintain it. And there are hygiene types. How to maintain hygiene in different sectors, the industrial sector, community sector, and personal sector. In industrial sector, by minimizing the hazards, if you maintain good hygiene condition in industry, it will minimize the hazards and it will assure the health of the workers. And in community, if you improve the sanitation, if the government improves the sanitation in the communities, and then the quality of life will increase. This hygiene in the community, if you maintain good hygiene condition in the community, automatically the quality of the life of people will increase. And personal hygiene, if you maintain good personal hygiene means what? Nothing but keeping one's body clean, keeping your own body clean and neat. That is called as personal hygiene. That will also reflect the health of an human being. Personal hygiene healthcare. How to maintain personal hygiene healthcare? By bathing regularly you have to take your bath, and by changing the clothes regularly. So regularly you have to wear the washed clothes, and washing your hands, cutting your nails daily, and brushing the teeth perfectly daily for 2 times, and washing your hair, and removing the unwanted hair, and exercise. By maintaining proper exercise, your personal hygiene healthcare will be maintained. Then what are the avoidable habits? These are the habits which you have to avoid. Eating at working desks. So you should not eat where you work. The working desk, on working days, you should not eat. Why? Because it will spread there and it will attach to your body only. Then leaving the dirty clothes wherever you want. You should not leave your dirty clothes wherever the place you want. Okay. You should leave these dirty clothes only at some place, some scrap place. And sneezing without covering with tissue. Always, whenever you are sneezing, you should cover your mouth with tissue. Not flushing the toilet. You have to flush your toilet. When you go to toilet, you have to flush it perfectly. And not washing hands regularly. Washing hands is one of the important factor for health. So that is why you should wash your hands regularly. And using dirty spoons and utensils is one of the most avoidable habit. And nail biting is also most avoidable habit. Why? Because most of the dirt will be there in your nails. And not brushing teeth daily is also one of the most avoidable habit. Brushing your teeth will keep your mouth clean and neat. And using too much perfume is also an avoidable habit. And not washing fruits or vegetables before use, and improper disposal of items is a most avoidable habits. These are the habits which a person has to avoid for keeping his health. So this is about sociology. With this, we have finished the first unit of social and preventive pharmacy. Thank you, Jai Hind. Powering.